Well, now to our Facts Not Fear coverage of COVID-19. The Omicron variant is taking control of the U.S. and more people are getting infected with the virus. And as we head into the new year, Ohio is topping in COVID-19 hospitalizations nationwide, though, even though we've been dealing with COVID-19 for almost 2 years now. There's still a lot of questions surrounding the virus. Dr. Jeffrey Marable joins us this morning from PrimaryOne Health to answer some of your questions when it comes to COVID-19 and the Omicron variant. Good morning, Dr. Marable. Thank you for joining us this morning.
Good morning. Thanks for having me.
Hey, let's jump right into, because I know many people are really confused when they first get sick and they can't tell if they have COVID, a cold, or the flu. You know, how do we differentiate between the ones?
No, that's a great question. It's not always easy to differentiate between the three. Oftentimes, you may present with fever, fatigue, body ache, sore throat, and you could have COVID, or you may have the common cold or the flu. One of the differentiating features of COVID, however, is a persistent dry cough, headache, difficulty breathing, especially if you have advanced disease, and the loss of taste or smell. However, with the Omicron variant, we're seeing fewer patients with loss of taste and smell. So my advice is, if you are unsure, get tested for both. Get tested for the flu as well as COVID.
Yeah, you know, and you bring up a good point here, and that was kind of my next question too, because the Omicron variant, it really is dominant in this country, very contagious, as we've all mentioned here. So the question is, should you get tested even if you do have symptoms or don't have symptoms?
Certainly. You should get tested if you've been around anyone you suspect has COVID-19 or has been confirmed to have COVID-19.
Hey, doctor.
There are a number of tests. Yes.
No, go ahead. Go ahead. Finish up, please.
I was about to say there are a number of testing locations throughout Columbus, including at PrimaryOne Health. And we offer testing on Mondays and Wednesdays at 2300 West Broad location and at 3433 Agra Road.
Yeah, great information too. Hey, you know, I need to bring this up, doctor. The FDA came out and said that the home test may not be as sensitive to the Omicron variant, but President Biden's medical advisor says that they're still useful. What do you suggest when it comes to taking those home tests?
Oh, I think the home test is extremely valuable, especially for those patients who have limited access. It's another tool in our toolbox, if you will, to help to prevent the spread of the disease. And we offer home testing at most of our sites. So I would encourage individuals to continue to use the home test, even if it's not as sensitive in terms of identifying Omicron.
Okay, another big topic here, doctor, is of course New Year's Eve tomorrow. What do you suggest people should do when it comes to those celebrations? Is it okay to gather?
You know, my advice would be, if you're going to gather, know who your audience is, right? If you have access to home tests, it's not a bad idea to have those individuals tested before attending your event. Certainly, if you have family members, if you limit your circle, if you will, you're less likely to be exposed. And I think it's a good idea that post-event, after the event, you should also test yourself. And certainly if you start to develop symptoms, that would be the opportunity where you absolutely need to get tested.
You know, doctor, science has been saying get tested. There are a lot of people who are still hesitant about doing it. I'd like to hear what you need to say, or what you have to say, a message in terms of those people who still really have questions about getting the vaccine. I should say vaccine, not tested. I want to talk about the vaccine here, doctor.
Sure. You know, I think we have to continue to be trusted messengers to go to the different communities throughout Columbus and beyond and advocate for the vaccine. Give personal testimonies. Tell folks how safe the vaccine is. You have to separate facts from fiction. And also reinforce to get your information from reliable sources, such as the Center for Disease Control or the Food and Drug Administration. And lastly, do not get your information from social media.
That's good advice. Dr. Marable, thank you for joining us this morning. I appreciate you getting up early. This is information that people really need to know, and you've really clarified it. Thank you so much.
You're very welcome.
Okay.